Okay, Dr. George Allen, I introduced him last night. He's one of the many high achievers, and he also did the patient satisfaction study, which many of you did. So he'll fill us in on that.
Good morning. I feel like I've had breakfast with all of you. Surprised me when I walked in too. But anyway, this study, we're all familiar with surveys. I'm sure when you leave here, you'll receive an email from Ross Bridges asking you how you liked your stay, was everything comfortable, and what have you. You go to your restaurants, you run into surveys all the time, and even in the casinos, they want to know how you enjoyed that as well. So this is a similar survey that was done in our network. And I don't know how many of you have ever wanted to do a survey in your own office, but here's one for those that did participate in the program. I don't think we got back the individual information, but I'm sure that's available if you wanted to get that as well. But anyway, this was the aims of the studies. We were to identify aspects of a restorative visit and treatment associated with patient satisfaction. Now, this is not talking about denture patients. This is not talking about surgery or the first exam. This is only talking about a restorative visit. Then we wanted to determine how satisfied patients were with the aspects of a restorative treatment and visit. We wanted to identify the aspects of the patient satisfactions that are related to each other. Then at the end, we wanted to find out if the dentist, patient, and procedural factors associated with the patient satisfaction, how well did they come up? Two of the other ones, we wanted to determine the dentist's view of the patient's experience. In other words, there was a questionnaire given to the patients, and the dentist had their questionnaire as well. And at this point, they wanted to know, what did the dentist think? Then at the end, we wanted to test whether the dentist's perspectives matched with the patient's self-reported satisfaction. You'll be surprised at some of the results of this because I don't know if the people that put this together saw the numbers coming, but they were very good numbers. Here are some of the questions that were asked of the 22 items. It's a questionnaire similar to this here. You can find this questionnaire on the network under the study 11, I think it is. And this is 6 of the specific components that they ask. Am I satisfied with how the filling feels? To hot, cold, and drink. Whether my dentist limited my pain during the procedure. Was I able to ask questions about the dental procedure? And how did the dental procedure, was it explained to me before it was started? And here's the catcher. They wanted to know how clean and organized the office was. This was something they asked the patients. And then another question they asked them, say, how long did you have to wait in the waiting room? Were you satisfied with the length of time? And this is a copy of the questionnaire. It's too small to read, but that's what I just put in my hand. Then they ask the dentist to predict what their patients thought. Did the patient have a strong preference to the restoration material that I use today? Did the patient perceive me as friendly? Was the filling procedure painful for that patient that day? Was the patient interested in information about the restorative procedure? And then overall, how satisfied was the patient with all aspects of the dental treatment and visit? We are in private practice, and many of us are on schedules. So some of the things that we asked the dentist to predict might not have even thought about it while they were doing the procedures. But they have information that's going to follow that'll show you what happened. This is the survey questionnaire given to the dentist. And this was sent back in, separately from the patient's questionnaire. Now let's go back to what the patient questionnaire was. The instructions were to wait till the numbers wore off, fill out this either tonight or tomorrow. Do not mail it back to your dentist's office. Mail it back in the pre-addressed envelope that was given to the patient. so that they would feel free to answer that questionnaire without having to worry about, is he gonna get that information or she's gonna get that information, okay? So, which made it a, I guess, a blind study or whatever they call those. But that's how it worked. And you ask, well, why the numbers need to be off? Because some of the questions that we're asking, you know, how did the tooth feel? Was it sensitive to hot and cold? And a lot of that couldn't be answered unless the anesthesia had worn off. Now, of the 7,286 patients that enrolled, they got back 5,879 people that actually got their surveys in. That's an 80% response. I mean, how many surveys get an 80% response? So apparently we're doing something right. Now, you say, okay, well, on the survey, we have strongly disagree, disagree, neither agree nor disagree, agree and strongly agree. They say, well, how can we put that in a percentage basis and actually put this into some type of perspective how this was perceived? So what we did, well, not me, they did it. They converted these responses, 1 through 5, of those things I just listed out, to 0% through 100%, where strongly disagree is 0%, and you strongly agree is 100%. Now you'll hear me refer to them as 4s and 5s, and you'll see the original values were 5s and 4s, 1, 2, and 3. Now, when you talk about overall satisfied with all aspects of the dental treatment, 22% were 100%. 22% of those that sent in those surveys. There's actually a question that was on there that is asked about the overall satisfaction to all aspects of the dental treatment. So I don't know if that information came directly from that question or whether the whole survey came up where 22% were 100. That was kind of questionable. But now, 65% of them was at least 90% satisfied with the treatment visit. Then you had 85% of them was at least 80% satisfied with the treatment. So what does that say for us in restorative dentistry? We've come a long ways. You know, patients now are at least 80% satisfied with those 5,000 ones that sent it in, okay? We talked about what they talked about last night, talking about getting 5,000 dentists in the network. Can you imagine what kind of information we're gonna get from that? Now, some of the components that were on the survey that were rated the highest, and they were most satisfied with how friendly and courteous the staff were, the friendliness of the dentist, skill of the dentist, how the dentist limited the pain during the procedure, and how clean, organized the office was and the amount of trust I can place in my dentist. Now, back in dental school, the only one we had to deal with was the skill of the dentist and how the dentist limited to pain during the procedure. But you see, from a patient's standpoint, there's the surrounding things, your office staff, how your office looks, basically how they can trust you. All those things are more important to a patient, but there's other things that feeling has to work, it can't hurt, and it has to last a long time, okay? So the things that we evaluate a procedure on is perceived differently by a patient, I would say. Some of the least satisfied components was the dentist gave me a choice between different materials. If you're like me in my office, they say, what does the insurance cover? So I say, ma'am, you don't want an amalgam on tooth number 8. All right, so we can usually sell a composite when they can see it, okay? But it is good if we can give the patient a choice and not let it be selected by what the insurance covers. None of them agree with our dental fees, and some of our dental fees are reduced so bad by insurance that it doesn't matter if you're charging a big fee or not. It's going to still be cut back, especially if you're in any kind of PPO. So they didn't know that, so they always are somewhat dissatisfied with what we charge for procedures. And the lowest rated component, again, is how long I expect the filling to last. And the other one is how the procedure was explained before it was started. I think the first one and the last one would be related. If you have telling them a choice of materials, then you would probably be explaining to them how the procedure is going to be done. But these are the things that the patients found that we did the least, and these were the things they were least satisfied with. Now, say, well, when was the patient most satisfied? With the more experienced dentist, those had higher ratings of satisfaction for interpersonal relationship and comfort component. Now, the interpretation given by this was because the greater proficiency of patient management and communication, as well as greater technical skills and speed that had been developed during the years of clinical experience. Okay? That goes hand in hand, I would think. You know, dentists just starting out, we did like, what, 32 restorations to graduate? And now you got to do another restoration, this is restoration 33. Whereas a dentist has been in private practice, did 33 in less than a week, you know. So a lot of skill goes in. So that should have been expected. And then another reason why the patient was most satisfied, this was interesting, that the dentist had placed the original restoration. The ratings and satisfaction for interpersonal relationship comfort component were higher. Okay, when the patient returns back and forth to your office, they develop a trust. Okay, so thereby their satisfaction. And plus, I think after they see you a few times, they're not quite as critical, and they do give you a little bit of leeway because at that point you develop a patient and a doctor relationship. Now, this one here, for the material choice value and sensory evaluative component, this is when patients were most dissatisfied, just as we talked about on the previous slide. Now, the satisfaction was highest, though, when the new restoration material was not an amalgam and when the tooth was not a molar. And we all know, having placed posterior composites, that it's a little more difficult to posterior deposit on tooth number 30 than it is on tooth number 5, okay? And you have a lot more tooth structure to cover. You got a lot more areas that you have to cover for sensitivity. And amalgam's been sensitive from the time I've been putting them in. So we used to use, I don't know if y'all use it anymore, Copalite. But anyway, Copalite supposed to have cut down the sensitivity. But now that we have the new bonding agents and what have you, I can see how this one was. So the interpretation was this, that the restoration done on molar teeth were larger, more challenging to restore, and they did have more post-operative sensitivity. So now, aim 5, when we go back to some of the aims of this particular study, aim 5 was to determine dentist's view of patient's experience. The treatment went without complications about 88% of the time. That's pretty good. We all want 100%, I'm sure, but we'll settle for 88. The patients experienced pain 12% of the cases. And the patients were anxious during 19% of the procedures. So these are the things that the dentist thought. So you say, okay, well, let's look at if the dentist was right and the patient was satisfied. Then we also evaluate whether the dentist is correct. Did I switch that? Yeah. And the patient was dissatisfied. And the last one, the dentist is incorrect, and the patient was, in fact, dissatisfied. We talk about the overall satisfaction of the aspect of this particular procedure. Then the first one, where the patient and the dentist both were correct and the patient was satisfied, that happened 85% of the time, which is good. So that means dentistry is somewhat predictable. Not always. Then the next one, where the dentist was correct, the patient was dissatisfied, that only happened 1% of the time. And the last one is when the dentist was incorrect and the patient was dissatisfied, that happened 14% of the time. So the little bubble at the bottom says that when the patients were dissatisfied with the overall visit, we were only aware of it 5% of the time, okay? So we're 95% right. So the concordance now concerning the friendliness, 90%. The patient knew that the dentist knew that the patient was satisfied and the patient was in fact satisfied. Where the dentist thought the patient was satisfied and they were not. Only happened 1% of the time, just like the previous slide, 1%. Then again over here where the dentist was incorrect, thought the patient was dissatisfied and the patient was dissatisfied, that happened 9% of the time. So again, when we see dissatisfied patients having to do with the friendliness of the dentist, we were only aware of it 7% of the time. Now there are two of these aspects on this same slide, material choice, and explain the procedure. And like I said, I think both of these kind of go hand in hand, because if you take time to tell them about the choices of material, chances are you're going to explain the procedure. So if you look at, these numbers aren't too far off, except for over in the last column, where the dentist was incorrect and the patient was dissatisfied, that 25% on material choice, and then 13% on the actual explanation of the procedure. So what does that say? I guess it says that we don't give patients much choice of material, but we do a little bit more of explaining what we're going to do. So it appears that the dentist knew the patient was dissatisfied, but he did not and could not address the issue. Now, I looked at that too and I said, well, they probably didn't address the issue on this particular visit, but I would think that most people address that issue when they return. Here are some of the conclusions that can be drawn, moving pretty fast. Behavioral science studies can be successfully performed in offices of practicing dentists. That's been proven. The overall levels of satisfaction with restorative visits are high. That's been shown with a high percentage. Important contributors to patient satisfaction were friendliness, the dentist and staff, the perceived skill of the dentist, and limiting pain during the procedure, and the trust in the dentist. High satisfaction ratings were received by the more experienced dentists, those in private practice, and when they had placed the original restoration. We talked about that. A small percentage of patients were dissatisfied, and in that case, most time the dentist was not aware of it. Okay, so from this particular study, then there's a lot that we could probably gain and say what we might be able to improve, but I think the numbers are pretty good already. So apparently we are fully or somewhat aware of a lot of the things that the patient are looking for.